Assalamu alaikum. Now I would like to discuss about the kidney stone. Start with this. This is the urine crystal of calcium oxalate stone, and it looks like envelope shape. And it looks like envelope shape. Envelope. This urine crystal looks like envelope, and sometimes you may get dumbbell shaped. So in calcium oxalate kidney stone, the urine crystal looks like envelope or dumbbell shape. This is first thing you have to remember. Then in calcium stone, it can be in calcium stone there may be calcium oxalate stone, there may be calcium phosphate stone. In calcium oxalate stone, the pH is low and urine crystal is I have already told about, and there and if you do X-ray or CT scan, you will get this radio opacity. This is radio opaque, and the causes include is vitamin C abuse. There is vitamin C abuse. There may be ethylene glycol injection. Ethylene glycol, which is an antifreeze. There may be malabsorption usually happens in Crohn's disease. Malabsorption, like a Crohn's disease. There may be hypocitrate urea. And that's why there is decreased pH. And this calcium oxalate stone is most common. It is about 80%. On the other hand, this is the picture of calcium phosphate stone. In here pH is high, and this shape look like prism. So what you have to remember, that calcium phosphate stone pH is high and it is prism shaped. It is wedge shaped. It looks like wedge shaped prism, and it is also radio opaque. And the one of the important cause is acetazolamide, which is a acetazolamide. Can you tell me acetazolamide is what kind of diuretic? It is carbonic anhydrase inhibitor. This acetazolamide can promotes this calcium phosphate stone, and in both cases as a treatment you have to use low sodium diet, citrate, low sodium diet, thiazide diuretics, and for here where there is calcium oxalate stone, where there is hypocitrate urea, you have to replace citrate. So as a treatment, low sodium diet in both cases, and thiazide is the drug of thiazide diuretics is a drug of choice, and for calcium oxalate stone you have to give citrate. Now this is the picture of ammonium magnesium phosphate urine crystal. Ammonium magnesium phosphate urine crystal. It looks like coffin lid. And if you do X-ray or CT scan, you will get same radio opacity. And the cause is very important. The urease positive organism, and it can be remembered by P chunks. That means P for Proteus, C for Cryptococcus, H for H. pylori, U for urea plasma, N for nocardia, K for Klebsiella, and S for Staphylococcus saprophytes. And these organisms usually causes this ammonium magnesium phosphate stone. It is also known as struvite stone. And the urease positive bugs, like these bugs, actually cause this ammonium magnesium phosphate stone. And these organisms that hydrolyze urea to ammonia, and there is urine alkalinization. This is a commonly formed staghorn calculi, and treatment is eradication of the underlying infection and surgical removal of the stone. This is the picture of uric acid stone, and the uric acid, an important thing you have to remember, that U for U, that means radiolucent. The uric acid is only radiolucent, and in here pH is low. In two cases, like calcium oxalate stone and uric acid stone, in these two cases the pH is low, but rest of the cases pH is high. Okay, in uric acid it is radiolucent, and this shape look like rhomboid shape. This shape look like rhomboid or rosette shape. This risk factor is decreased urine volume. In decreased urine volume, risk factor is decreased urine volume, usually in arid climate and acidic pH. Strong association with hyperuricemia. Strong association of hyperuricemia, like gout, and often seen in disease with increased cell turnover, like leukemia. Where there is increased cell turnover, in that case there may be formation of this uric acid stone. For this reason you have to alkalinization of the urine, and you have to give allopurinol, because there is hyperuricemia. Hyperuricemia can lead to gout, and we know that the medication of gout is allopurinol. So in uric acid stone it is rhomboid or rosette shape. The U for U, that means radiolucent, there is uricemia, decreased urine volume, hyperuricemia, and increased cell turnover. And last stone, this is the picture of the cystine stone, and it looks like hexagonal, 1 2 3 4 5 6. This is hexagonal shape, and it is cystine stone. And in here pH is increased, in here pH is decreased, in here pH is decreased. One thing I want to say it clearly again, that pH is increasing two stone. One is ammonium magnesium phosphate, and other is calcium phosphate. In these two phosphate there is increased pH. In these two phosphate there is increased pH. In the rest of the cases there is decreased pH. And the cystine stone, you have to remember that it happens in childhood, usually occurs in childhood, and this is recessive, that is autosomal recessive. This is autosomal recessive disease. This is autosomal recessive, and in here there is cystine reabsorbing PCT transporter. This cystine reabsorbing PCT transporter loses its function, and there is transportation defect also results in ornithine. This is high yield. There is a mnemonic saying cola, and I am just saying this cola, that cystine reabsorbing PCT transporter loses its function, and that's why transporter of ornithine, lysine, and arginine, transporter of ornithine, lysine, and arginine, mm, there is pore resorption because there is transporter defect. So this cysteine, ornithine, lysine, and arginine has got decreased reabsorption, and it is sick. This is hexagonal shaped, and it can form staghorn calculi like ammonium phosphate stone. It can form staghorn calculi, and for confirmation, you can do sodium nitroprusside test. Sodium nitroprusside test is positive in this cysteine stone. And as a treatment, you should give low sodium diet, you alkalinization of the urine, and chelating agent if refractory. And chelating agent if refractory. And last thing I wanna discuss a small thing, that relative concentration along the proximal convoluted tubule. Relative concentration along the proximal convoluted tubule. This is the picture of relative concentration along the proximal convoluted tubule. In here, A is para-aminohippuric acid, C is creatinine, B is inulin, F is urea, D is chloride, J is potassium, and this L is sodium and osmolarity, and this is bicarbonate, this is amino acid, and the last is glucose. And you have to remember this serial parameter. You can remember this mnemonic, that PCI unit, that means para-aminohippuric acid, creatinine, inulin, urea, call. We are actually doing the duty, and we do that. We are doing call, that is Corbo in Bangla. Corbo, no, we will not gonna work in PCI unit, and that is the mnemonic. So what we will do then, we'll do sheet. That means in Bangla, in sheet called Hagu, and that is my name. That PCI, para-aminohippuric acid, creatinine, inulin, urea, chloride, potassium, sodium, and sodium and osmolarity, and bicarbonate, amino acid, and glucose. And that is all about this two things. Inshallah, you will be benefited if you just study carefully. If you just study smartly, inshallah, it would be very, very helpful. And pray for me.